Welcome to Webinar Wednesday. I am your host, Kelly Cothran, and I want to thank you for joining us today. So I know I'm not the only one who enjoys listening to music while exercising, right? For me, plugging in my earphones and cranking up that music helps me get right in the zone. But little did I know that 3 in 5 Americans are prone to develop hearing loss due to loud music from their earphones. Although earphones might not be the only hearing loss culprit, it's important to know how to protect your ears from loud noises, aging, disease, and heredity. Today we are covering a health topic that has never been covered before in webinar history. I have with me audiologist Dr. Jennifer Kimberly from Kelsey-Seybold's main campus as our presenter. She is board certified by the American Speech Language Hearing Association. Her clinical interests include pediatric and adult hearing aids. She joined Kelsey-Seybold in July 2006, and she enjoys spending most of her free time outdoors, traveling, camping with the family. Now it's time to hear from you. In your webinar window, you should see today's poll question. Do you listen to music through earbuds or headphones? I will go ahead and launch that and give you a few seconds to answer. All right, thank you so much for participating. At the end of the webinar, we will reveal the results and take any questions you may have. Now I will turn it over to Dr. Kimberly to get us started.
Our family and friends first. 20% of U.S. adults report some degree of hearing loss, and at age 64, 1 of 3 people has a hearing loss. So what can cause hearing loss? There are 2 main factors that are causes for hearing loss. The first one would be noise. Being exposed to noise every day, such as listening to loud music. Those sounds can damage the inner ear and lead to permanent hearing loss. Noise-induced hearing loss can happen slowly over time, but it also can happen with just one exposure to sudden or traumatic noises. Age is another cause of hearing loss. Changes in the nerves and cells of the inner ear that occur as you get older cause a gradual but steady hearing loss. This hearing loss can be mild, severe, and is typically a permanent hearing loss. There are, of course, other causes of hearing loss. Buildup of earwax, which is easily treatable. See your ear, nose, and throat physician, and they can get that out, and usually the hearing problem is resolved. Additionally, objects in the ear. That typically happens more with children, but can happen with adults too. Probably the most common would be the cotton swab from a Q-tip, even though we should not use Q-tips. An injury to the ear or the head, ear infections, ruptured eardrums, fluid in the middle ear space, typically occurring after a cold or the flu, and even sometimes after traveling on an airplane, otosclerosis, and then there can sometimes be growths in the ear canal. So all of those things can be additional causes for hearing loss. So what happens when we hear? Sound travels through 3 main structures in the ear. In hearing loss, one or more of these structures is damaged. Sound is collected by the pinna, which is your outer ear. It travels to the external ear canal. Then it goes to the middle ear, which is separated from the ear canal by your eardrum. Then the inner ear is the actual sensory organ of hearing. It's actually called, contains the cochlea, which is the main organ of hearing. The inner ear also contains structures related to balance. There are two types of hearing loss. The first being conductive hearing loss. This is typically more of a temporary type of hearing loss. It's where sound energy is blocked before it reaches the inner ear. Examples of conductive hearing loss include middle ear fluid. So when children or adults have ear infections and a fluid builds up behind the eardrum, that can cause difficulty with the sound transmitting to the inner ear. Perforations or holes in the eardrum, and something as simple as earwax. Some conductive hearing losses are not temporary. You can have something called otosclerosis. I mentioned that earlier. It's where there's a stiffening of the middle ear bones, and that is sometimes can be resolved, but is not as temporary as something as middle ear fluid or perforations. The other type of hearing loss is sensorineural hearing loss. Sensorineural hearing loss is typically related to aging or noise-induced hearing losses. Can sometimes also be caused by ototoxicity from medications. So sound reaches the inner ear, but there's a problem in the inner ear or the nerve that prevents proper hearing. And sometimes it also prevents distortion in the signal, so patients will complain that they can hear but have difficulty understanding, and that's related to that permanent damage in the cochlea. Symptoms of hearing loss include muffled hearing. So you'll hear people often complain that they think people mumble. Difficulty understanding what people are saying, especially with competing voices or background noises. Being able to hear someone speaking but not distinguish specific words. And then listening to the television or radio at a higher volume. And often we hear spouses and children complaining that they can't sit in the same room with somebody because they have the TV volume turned too high. When someone has a hearing loss, it can be very socially isolating. You might find that people start to avoid conversations and social interactions. The social situations can be tiring and stressful if you don't hear well. And so people just tend to outright avoid these situations. You may see somebody sitting in the corner, their arms crossed, not engaged in conversation, and you think they're just not interested, when a lot of times it's just related to a hearing loss. And depression can also be a symptom of hearing loss because it's affecting people's social life. They feel like they're not engaged, not involved, missing out on family and friends and those things. Additionally, some symptoms of hearing loss that can occur would be ringing, roaring, hissing, or buzzing in the ear. And this is called tinnitus. Some of you may have heard it as tinnitus. Same thing. Basically, it's a noise that you hear in the ear that's not really present, and it is often related to hearing loss. Ear pain, itching, or irritation. Pus or fluid leaking from the ear. This would be more related to an infection that would cause a temporary hearing loss, maybe a middle ear infection, perforation of the eardrum. And vertigo, that is also a symptom of hearing loss sometimes. There are specific disorders, as you see on the screen, acoustic neuroma, labyrinthitis. Those are things that, additionally, Meniere's disease is another one where vertigo and hearing loss go hand in hand. If you think you have a hearing loss, the first step begins with a physical exam of the ear. Here at Kelsey, we prefer that patients see the ear, nose, and throat doctors first. That way the doctors can check to make sure that there's no wax, foreign debris in the ear canal, and that the ear is healthy, no fluid, those kinds of things. In that same visit, you'll be sent over to see an audiologist, and we will perform a hearing test to determine the type and degree of hearing loss. At the time of the visit with the ear, nose, and throat doctor, they will use an otoscope to look in the ear, and that's when they're looking for the earwax, obstructions, infections, fluid, injuries, those types of things. But the hearing test and the ear, nose, and throat visit will all be completed in one visit. All right, we're going to start talking a little bit about preventing noise-induced hearing loss. The first thing that you can do is just make hearing health a part of your lifestyle. So that includes wearing hearing protection, staying away from loud or prolonged noises when you can, and this even includes things like lawnmowers, blowers to blow off your driveway, any kind of power tools. Turning down the music volume. This includes in your car as well as with headphones or earphones. You can also buy power tools that have sound controls, but the best thing to do is to wear hearing protection. So when you are around noise, working or playing, you can use hearing protectors such as earplugs or earmuffs. These can be custom devices. We do make those here at Kelsey-Seybold Clinic, or they can be something that you get at the pharmacy or the hardware store sells them as well. And if you suspect hearing loss or you're around such levels of noise, sometimes double protection is necessary, where you can put an earplug in the ear and then wear the earmuffs over the earplugs. It's important to teach your family how important it is to stay away from too much noise. And then if you think that there is an issue, make sure that you get to your ear, nose, and throat physician and audiologist as soon as possible to get your hearing tested. Some of the common noises that might hurt your ears are listed here. So you can see that firearms can range from 140 to 170 decibels. Motorcycles, lawnmowers are down around 90 decibels, but prolonged exposure to even 90 decibels is damaging to your hearing. If you feel like you've been exposed to some of these noises and you may have had some issues, some things that you might notice, or you can't hear someone from 3 feet away, your ears might hurt after an exposure. You'd again have that buzzing or ringing that we talked about earlier, and you can hear people but not understand. So those are symptoms of noise-induced hearing loss from exposure to any of these items. Hearing loss in teenagers is about 30% higher now than it was in the 1980s and 1990s. In fact, in 2006, there was a study of high school students, and over half of them reported at least one symptom of hearing loss. Studies are showing that 1 in 5 teens actually have a form of hearing loss, so the symptoms could be just something like tinnitus, which might be the start of a hearing loss. Today, teens are listening to their music twice as long and louder than they did in previous generations. And one of the things that's contributing to that is the fact that we can listen to our music nonstop on our phones or iPods or MP3 players, whereas before you gave yourself a little bit of a break when you had to change your cassette tape or your CD, if I'm dating myself a little bit. All right, living with hearing loss. So if you've seen your ear, nose, and throat physician and your audiologist and you've been diagnosed with a permanent hearing loss, hearing aids might be the next step for you. Hearing aids are electronic devices to amplify sounds in the frequency range of the hearing loss. Initially, when fit with a hearing aid, common background noises may be distracting and take a few days or weeks to get used to. The nice thing about hearing aids is you do get a trial period, so we give you plenty of time to make adjustments to the devices as well as to make adjustments to your brain understanding the signals it's hearing. There are also assistive listening devices. These are devices that make certain sounds louder by bringing them directly to the ear. Some of the examples of these devices would be devices for the television. There's a device called TV ears, which people will often plug into their television, wear some headphones, and then their family can listen to the volume where it is comfortable for them, and they get the volume where it is something that they can understand with the hearing loss. There's also a device called a pocket talker, which is basically a set of headphones, and a microphone that a patient can wear. That they don't really want hearing aids or can't have hearing aids for some reason, those devices can be beneficial. Some other devices that can assist you if you have a hearing loss are alerting devices. These can alert you to things such as the doorbell, a ringing telephone, baby monitors, and smoke detectors are another large area of need for the alerting devices. Television closed captioning, that is where the words scroll across the bottom of the screen and make it easier for you to watch television so that you can read what is said. So it kind of fills in the gaps for those people that have that difficulty with understanding related to a sensorineural hearing loss. And then there's also a thing called a TTY, which is a text telephone. That's typically reserved for patients with severe to profound hearing loss, but it allows messages to be typed back and forth so that the person with the hearing loss doesn't have to rely solely on listening. All right, we're going to talk about some ways to help people with a hearing loss. We talked about earlier how having a hearing loss can be very socially isolating and depressing. And that is related to the person feeling cut off from conversations and social interactions. It also requires a lot of extra effort in order to listen when you have a hearing loss. So the extra effort and stress can be very tiring for people. Oftentimes people, after they have been fit with hearing aids and become accustomed to them, they realize how much more energy they have throughout the day because they're not having to struggle to listen all day long. Some ways that you can improve communication for somebody with a hearing loss. Make sure the person knows that you're speaking to them. So if you're trying to get your spouse's attention, call their name. Make sure that you give them that time to make their auditory system ready to process the speech that you're going to give to them. Speak to the person at a distance of 3 to 6 feet. Face-to-face communication makes a huge difference. Most people don't consider themselves speech readers, but we all do better. Even those of us with normal hearing, we do better by being able to see the words from someone's mouth. We can tell the difference between certain sounds by just seeing them on the lips. Want to refrain from speaking directly into a person's ear. And that's partially because your facial expressions and gestures would provide helpful visual cues, and they're missing that when you're speaking directly in their ear. But also, it is a distorted signal, especially a whisper. Whispers are very distorted signals, and so even with a hearing aid, they are often hard to understand. Speak slightly louder than normal, but don't shout. Again, that's another issue related to having a distorted signal. Cut down the background noise. So if you're just going to have a nice quiet conversation with a family member or a friend, turn off the television or turn off the radio. Turn down the radio in the car. Make it easier for people to hear the conversation. And again, including people in conversations, that goes back to the fact that hearing loss can be very socially isolating. All right, so the most common causes of hearing loss are age and noise. There are several different symptoms of hearing loss. We talked about vertigo, we talked about ringing in the ears, we talked about feeling isolated. Hearing loss, many hearing losses can be prevented, especially the noise-induced hearing losses. There's been an increase in young adults with hearing loss, and it is likely because of the music they listen to. If you have concerns about your hearing or someone else has brought up concerns about your hearing, get in and get your hearing tested. And we went over several different ways to make living with a hearing loss a bit easier.
Thank you so much, Dr. Kimberly. That was great. So now we're going to take a few seconds to give you all a chance to submit your questions, and we will begin our question and answer session. All right, it looks like we have plenty of questions already in. So we're going to go ahead and get started, Dr. Kimberly. Okay, so what is the effect on infants hearing loud music or the television? That's a good question.
Well, as with any person hearing loud music or television, it's often a problem that builds. So with a noise-induced hearing loss, you tend to have damage that slowly chips away basically at the cells in the inner ear and the cochlea. And so it can be just as damaging to infants as it can to children and adults.
Okay. Another person asked, why do you say not to use Q-tips? If a person uses Q-tips only in outer part of the ear canal, what is the problem?
The problem is that what happens is when you push a Q-tip into your ear canal, you often push the wax that was making its way out of the canal deeper into the ear canal to a place that it cannot shed the wax on its own. So that's the number one cause of impacted cerumen or impacted wax in the ear canal is using those Q-tips.
Let's see. All right. A person submitted a question. She said that she is half deaf, wearing hearing aids, using closed captions such as for movies helps. But in the real world, it is very unpleasant. It is a very unpleasant way to watch a movie or TV show, especially in a movie that is mostly dialogue. Do you hear that from other patients?
Unfortunately, it's not a perfect situation, and yes, we do hear that from other people, especially when it's live captioning, such as maybe a sporting event and those kinds of things. The people that are doing the captioning can't always quite keep up. So the captioning is really there to assist you and aid in the words that you miss. But it's not a perfect situation, unfortunately. So I'm sorry that you experienced that.
You touched on this a little bit earlier, but what would you say is the absolute best way to clean your inner ear?
Okay, so I'm going to clarify that a little bit. When you use a Q-tip, you're actually still cleaning the outer ear. The outer ear consists from the pinna, which is your earlobe and the outer portion, all the way to the eardrum. The inner ear is the organ that does the hearing. And so to clean that area, really the wax should migrate its way out on its own. You can take like a small washcloth and just clean the very outside of the ear canal. But using Q-tips is definitely not recommended.
I did not know that. I learned something new every day. Okay, so someone works with a power tool and is often surrounded by noisy tools, electric tools like compressors, power washers, and mowers. How do you recognize if this noise is too much for your ears, and what do you do if it is?
An easy thing you could do, and it would just be kind of a gross estimate, but if you have a smartphone, you can download a sound level meter and just get a general idea of the amount of noise that's being created by those pieces of equipment. But I can tell you a compressor, pressure washer, those kinds of things, for an extended period of time, those are damaging to the ears. So the best thing to do is just buy a pair of earplugs or earmuffs, keep them handy, and when you are around those tools, go ahead and protect your hearing. It usually takes an extended period of time. You just get a little bit of damage time after time, but if you are starting to notice a change in your hearing, then it's too late. So you want to go ahead and protect it before you notice a problem with your hearing.
I don't believe we talked about this within the presentation, but is hearing loss permanent, and can it be reversible? Can you, is there any way you can?
Most hearing losses are permanent.
Okay.
So if you have a hearing loss related to genetics or age and noise, most of those, the sensory neural hearing losses, that is defined as a permanent hearing loss. When it is reversible would be if it's related to something, conductive problem, so middle ear fluid and those kinds of things. And so then that typically requires treatment from your ear, nose, and throat physician, and then typically those can be reversed.
Okay. Do you have any resources or websites that you like to point your patients to if they want to find out information about, how to protect their teens from those earbuds? Or
I do actually for the earbuds. This would be specific to iPods or Apple products, but you can go to www.apple.com/sound, SOUND, and they have some instructions there on how to limit the volume level of earbuds. Basically, one of the things you can tell your teens and family members is that if people can hear the sound next to you, then it's too loud. And I know that a lot of people still like to wear it that loud, but it is damaging to the ears over time.
Okay. I guess this question is for me too. Is it bad to listen to music with earbuds in a low to moderate tone, or do you recommend not using them at all?
I think with appropriate levels of volume, it's definitely okay to use them. I mean, I use them myself. It's the extended time. So we talked about earlier that with iPods that have just gigs and gigs of music in them, that you can have continuous play for a long time. That those your ears need a break, but it is definitely okay to use the earbuds. You just have to watch the volume.
Okay. We just received another question. My grandson has a lot of earwax, so much that it looks like liquid coming out of his ear. Why do they have so much, and is there anything that I can do to prevent it from happening?
Yeah, everyone's just a little bit different. I have one daughter that has almost no wax and another one that has quite a bit. Basically, it shouldn't impede his hearing unless it gets plugged up into the canal. So using a Q-tip and pushing that wax into his canal can make it where it won't come out. It shouldn't be a problem though. It's just normal. Some people have a lot of wax and some people have very little wax. We're all a little bit different.
Well, thank you so much for submitting your questions. I think Dr. Kimberly and I both enjoyed finding out what all is important to you all and hopefully getting your questions answered at the same time. I now want to share the poll with you for all those who participated. If you remember, my question was, do you listen to music through earbuds or headphones? And as you can see, 57% said yes, and surprisingly, 43% said no, which I think is very shocking because, in the era of iPhones and everything else and all of this technology, you would think earbuds are the first thing that people go to listen to music. So I just wanted to share that with you as well. Thank you so much, Dr. Kimberly, for such a great presentation on hearing loss. That concludes our webinar for today, but be sure to join us next month when Dr. Felicia Jordan presents Beat Travel Fat Traps, Travel and Healthy Eating. This is so hard for me because I love traveling, but I love eating out as well. So it's definitely a catch-22. Before we sign off, it is also National Nurses Week, so I want to take the time to thank all of our nurses at Kelsey-Seybold Clinic. Nurses are one of the most trusted professions in the nation, and you all play a huge role in the success of Kelsey-Seybold, so thank you. Also, Mother's Day is this weekend, and I want to wish all of our mothers who are tuning in a happy Mother's Day. And if you are on Facebook, Twitter, YouTube, Instagram, or Google+, be sure to find us and add us. Thanks again for tuning in, and we will chat next month.